Thank you very much for your interest. I just didn't want to miss this opportunity today to be with you all for this really important workshop that's happening. So thank you, Arash and Mehnaz, for organizing. I just wanted to take advantage really of the COVID, all what happened during COVID pandemic and the huge importance that was highlighted for data and for evidence and for having strong systems in place, information systems and others to support us better managing the pandemic and many other emergencies. But I think I was discussing with Arash this morning, one of our toughest challenges this morning was to actually have good data, quality data, to help us manage the pandemic, because without data, you cannot make the right decisions, right? And the main purpose of the workshop is to do training on how to develop good policy briefs for evidence-informed decisions or policy making at country level, which is ultimately the main goal of many of you at the ministries and country level. So I just don't want to really even emphasize how critical such work is for the countries to be able to have strong policy briefs, to use all the capacity we have in ministries of health working. I see many colleagues, stakeholders, collaborators from other academic institutions at country level who are there also to support the Ministry of Health in this important task. But very, very critically, since we have such a big audience today, we need to highlight the importance of having data. Without strong data, without strong information systems and evidence, we cannot even have these evidence-based policies, and we cannot even develop the briefs that are important for these policies. So we are working very closely as WHO with many of you, we have multiple groups actually here at the level of the Eastern Mediterranean Regional Office, trying to work together to build systems in countries that will generate better data and that will support the ministries of health capacities and the country capacity to really develop many of these policies. I think we have done a lot especially over the last 3 years during the COVID pandemic, but we still have a lot to do. And I think it's very important for all of us before people forget, because I think after COVID is gone, we're going to forget very quickly. So before we forget, we need to take advantage of this momentum to ensure we build that capacity at the countries. I think the policies briefs are a very key tool for policy making. They summarize the best evidence, especially for policymakers who don't really have time to read all the data and the articles, etc. And we look forward to help you with that task, working with all our colleagues, our partners in countries, in academia, and other institutions, to make sure that our countries have all that capacity to develop these briefs. I've attended them before, and I think it's a very nice course. It comes also very handy to take even by other colleagues later, because I think the work that was put into it was really very thorough, and it's very easy relatively to follow the course. But as always, we say the best way to learn these things is to do them. The more briefs we do, the more we learn, and the quality overall of the briefs will improve, and it will help you. Many of you who are the professional public health officers, it will help you to better advocate for the many public health priorities that you have also at the country level. So thank you again for your participation, and hopefully at one point we look forward to meet you in person. Thank you, Arash and Mehnaz, over to you.
Good morning, good afternoon, everyone. Thank you for joining us in this workshop, and hope everyone a very productive and fruitful meeting. I am Mehnaz Khairandish, Regional Advisor for Evidence and Data to Policy. I will present my presentation on understanding policy briefs, which includes 3 main topics. I will explain a bit about policy making processes, and policy brief as a tool for informing policymaking processes. Also, I will present a few examples of policy briefs, of developed policy briefs, and to see how we can identify the key messages through these policy briefs. And at the end, I will present the template recommended by WHO EMLO for developing policy briefs. So first of all, let's see what is policy and what is evidence in evidence-informed policy making. The policy which we talk about in evidence-informed policy making, which is the focus of this workshop, is a policy, the course of actions taken by governments and big institutions which affects the society. So it means that whatever the decision is, if governments decide to do something or decide not to do any action, or even if governments decide to keep, maintain, and continue the current existing policy, all of them are defined as policy. And policy can be categorized in 3 different levels: international, national, and subnational levels, which policy briefs mainly develop to address and inform national policy-making processes, but we can also develop policy briefs to be used for policies concerning more than one country, I mean a group of countries. And also we have evidence-informed policy making, which means that we have definition from WHO that says evidence is the form of knowledge which with sufficient quality to inform decisions. And we have best available evidence that we use it a lot for evidence-informed policy making, which means synthesis of high quality evidence from global databases such as systematic reviews, which is combined with local evidence to design context-specific solutions. Also, it can be complemented with tacit knowledge whenever that explicit knowledge from local contexts is of poor quality or is not available. Also, we have definition from WHO EMRO in 2019 for evidence-informed policy making, which means establishment of structures, processes to identify the priority health topics and the best available evidence for the selection of effective interventions, and to inform policy-making processes and to inform them with the best available evidence. As Dr. Rashidian kindly mentioned, there is a concept which is called multi-concept approach for evidence-informed policy making, which is developed in 2019 and endorsed in the regional committee in 2019. You can find the source on this slide. Through this concept, what is we aiming is we have different training programs, as you can see here, which are the main sources of evidence and data. But the issue is that if countries have all these technical programs in the Ministry of Health, they are not talking together and they are working separately. And what we are promoting in the region is to establish integrated system, which all these training programs within the health system are talking together, have links together for better and more effective evidence-informed policy making. So as all of you know, policymakers mainly have 4 categories of questions which they face during policymaking processes. So first of all, there is a question that what is the priority problem? What is the main issue that needs evidence to be addressed? After that, they are looking for what are the policy options available for that to address that problem. What are the effective, of course, and safe policy options? And if there are some policy options, are they cost effective? Are they affordable? And the last question is, okay, so we know the problem, we know the policy options to address that problem, we know that they are cost effective, but are they feasible to be implemented in a sustainable manner? So these are the main 4 categories of questions that mostly policymakers have, and to address them and to answer them, they need evidence. We have different sources of evidence that I know that Dr. Rashidian will explain more in his presentation later. So there are different sources of evidence to be used to address and answer these questions. which some of them as a household surveys, you can see that they can be used to answer all these types of questions, but some of them you can use to answer specific type of questions. But we have also another source of evidence, which are knowledge products, including policy briefs, health technology assessments, guidelines, health observatories that can be also used to address these questions through informing the best evidence. And as you can see here, policy briefs can be used, can be developed, and can be used to answer all those four categories of questions. So it means this is the reason that we say that policy brief is a key tool to inform policymaking processes, because we can develop them to address all questions raised by policymakers. But the issue that we have, not in region, at global level, is accessing to quality policy brief, which is based on robust evidence in a timely manner. So what is a policy brief? A policy brief, a quality policy brief, a useful policy brief should be brief. This is the first criteria to have a policy brief. So it should be brief document. It should include, the policy brief should be based on best available evidence and should be relevant to the content should be relevant to the problem which is policy brief developing for. Also, policy briefs should include and illustrate policy options and key messages addressing the problem which the policy brief is being developed for. And finally, one of the, I can say, very important criteria for having a useful policy brief is presenting the policy brief in an appropriate format, template, to be user-friendly for the end user, which is mostly policymaker. But as you can see in the field, in practice, there are several policy briefs that they do not meet these criteria, at least most of these criteria. For example, we see several policy briefs which are too long, they are not brief, they do not address the key problem, and even they do not have any policy options. They do not present any key messages in the policy brief. So I will just present some of the examples here. As you can see here, this is a table including the titles of some of developed policy briefs. So as you can see here, these titles are very, we can see they are concise, short, informative, and catchy titles. But just look at this title here. When you see ICN policy brief, it's not a kind of understandable title. I mean, by reading this title, you cannot understand that what is the content of this policy brief and what is the topic. And if you go to the subtitle, you will find it too long. This is the same as another topic here, which is too long. So, I mean, the first thing is to select a short, concise, catchy, but informative title for a policy brief. So let's go for some of other examples. And this is a policy brief on improving access to artemisinin-based combination therapies for malaria in Burkina Faso. So in the policy brief, it says that we have some policy options that you can find them in table 1. And also it says that there are some implementation considerations that you can find them in table 2. Let's go to the tables. As you can see here, this is table 1, and there are the policy options defined very clear, very informative with key messages, which are the available policy options for that problem to inform policy making, that these are available policy options based on valid evidence. And then, as you can see here, there are including the kind of description and advantages, disadvantages for each policy option. As you can see here, this is the kind of description for each policy option, then advantages, disadvantages, costs, and also acceptability of each of the options. And in the table 2, as you can see also here again, these are the 3 options suggested and found through the evidence. And these are the implementation consideration for implementing these policy options and the strategies suggested by author for the implementation. So we can say that this is a very good example of policy brief because it includes the policy options to inform policymakers that what are the available policy options. And again, here, this is another example, as you can see, which it says that, okay, this is the policy brief for improving patient safety for better quality of care. The problem is completely clear here. But the issue is, as you can see here, for policy options included in this policy brief, the policy brief is required to include clear policy options and as much as possible with actionable message, with key messages. But here, for example, in the first option, which is writing nurse staffing models for health facilities, which it seems that is not clear enough what is recommended, what is the policy option here to address that problem. And even in the description later, you can see that there are several items regarding the evidence available for them, and there is no key messages. So what mainly makes policy brief different from other types of products is policy brief should include policy options available based on evidence to address that to address that problem, which I mean to inform policymakers to enable he or she to make decisions considering the available evidence. So I just want to very briefly introduce the template, which is producing by, which WHMR is producing the template for development of policy brief. As I mentioned earlier, and all of you know that the policy brief should be a brief summary of evidence, the standalone document focus on the single topic, on a single problem, and it is recommended to be a maximum 8 pages or maximum 3,000 words, not more than it. These are the 9 key elements that we recommended to include in a policy brief to have a kind of useful quality policy brief for policymakers. And I will go very fast for one by one to each of them. So as you can see here, the title we discussed that should be short, focused, and avoid using any abbreviation, even not just in the title, even through the content of and body of the policy brief, unless it's a very well-known abbreviation. We should include the justification, which is introduction, background, as we have for other studies. And in the justification, we should clearly say that and indicate that what is the problem and why this problem is important. And also in the justification, we should clearly mention that what are the items that we are not covering in the policy brief. After we have key findings, the main policy options, it should be, as I show in the previous one, that in the first example, we had clear key messages, clear actionable messages and policy options. So we need to have, as much as possible, a kind of policy options with clear messages and actionable messages. Then we have description, which is better to be provided using table that is recommended in our template. So you will, have policy options. For each policy options, you will describe what is this, what is the main advantages, what is the main disadvantages of that policy option, what is the cost and feasibility of implementation, and also what are the responsibilities for the key stakeholders for implementing of that policy option. And after that, we will have method. This method should be very, very brief, just to inform policymakers, to convince policymakers that this is developed using the best and valid and latest evidence. So this is just to having a very, the main part of the methods used for development of policy brief. And if if you can find other maybe important considerations regarding how to monitor, how to evaluate the implementation of the and use of that policy briefs and policy options, and also if there is other, suggestions for further assessment to just inform policymakers that there are some other considerations to be taken into account when you are going to use these policy options. And finally, we will have acknowledgements, conflict of interest, including all people who helped you, who involved in development of the policy briefs, and just a few references, which are the main references used for development of that policy briefs. Thank you. I just end my presentation now, and I would like to invite Dr. John Lavis, Director for WHO Collaborating Center for Evidence-Informed Policy from McMaster University. Dr. John Lavis, please, the floor is yours. Thank you.
I'm just going to set the stage for the slides about policy briefs with a more general argument that we need to formalize and strengthen each national evidence support system. This, in my view, is different from the research system that most of our countries have had in place for many decades. Different also from the innovation system that many of our countries have had in place for many decades. An evidence support system is grounded in an understanding of the national context, including the time constraints that policymakers work under. It's demand-driven, so the questions and needs come from policymakers and other system leaders. And it's focused on contextualizing the evidence for a given decision in an equity-sensitive way. And I have here 4 examples of infrastructure, and I'm going to talk about 3 of them when I refer to policy briefs or the policy dialogues that they inform. So ideally, every country would have a unit that can combine the power of national evidence and the power of global evidence. And a very, very common format to do that in is policy briefs, and that's what I'll be talking about. But we also need mechanisms that bring together people with methods expertise and with lived experience alongside experts, pre-circulate an evidence summary. Today, we're talking about policy briefs as an input to this type of process. And then ideally, what comes out of that type of a process are clear statements about ways forward. They may take the form of recommendations, and policy dialogues can be an example of that type of process. I'll skip the 3rd point and just move on to processes. We also need processes to elicit and prioritize evidence needs. I'll talk about this in a more informal way, but some countries do have very explicit mechanisms of periodically checking in with senior policymakers, senior system leaders, to identify their most pressing concerns and then commission policy briefs with or without policy dialogues to inform them. And then we need to be able to find and package the evidence that meets those needs within set time constraints. And again, that's where policy briefs come in. So policy briefs and policy dialogues are an absolutely critical tool in an evidence support system. Another point that is important is that evidence support system in general, but also a policy brief in particular, needs to match the right evidence to the right step in the decision-making process. So if you have data analytics, that's particularly helpful at the front end in understanding a problem and its causes, particularly helpful at the back end for monitoring and evaluation. Modeling is often used in the first 2 steps, the problem workup, but also in some situations to help select an option for addressing a problem. Evaluation, of course, comes in step 4. Behavioral and implementation research comes in step 3, identifying implementation research. and qualitative research that helps us understand the views and experiences of patients, of providers in the system, of organizational leaders can be very helpful at all stages. Qualitative research can help us understand how a particular group in society experiences a challenge with the health system. It can help us understand how frontline nurses may respond to a potential option to address a problem. It can help us understand how organizational leaders in the system, like hospital CEOs, may struggle with implementation of a particular policy option. So very important to think about these different forms of evidence, and particularly these different forms of national evidence. An evidence support system and a policy brief also needs to combine that local evidence, whether that be national or provincial or state level evidence, with the best evidence from around the globe, typically in the form of an evidence synthesis. So you'll see those same 5 forms of evidence that I talked about before that would be drawn upon in a policy brief. But the writers of the policy brief would also be looking to the best evidence from around the globe and identifying that evidence that would be applicable to their country. One of the big dramatic innovations that has accelerated during COVID-19, so over the last 2+ years, has been the emergence of living evidence syntheses that add new evidence as it's made available based on its quality. So we've seen a number of living evidence syntheses that have been updated for now more than a year, in some cases 18 months, and sometimes updated as frequently as once a week. So in fast-moving areas of COVID-19, as the preprints come out, as every new study or report comes out, that new evidence is added into the living evidence synthesis. So you have a continually evolving picture of what the entire evidence space tells us, not just the newest study. And these living evidence syntheses are critically important for those of us preparing policy briefs, because we can turn to them periodically and pull in the most up-to-date evidence. These living syntheses, like all good syntheses, don't accept the journal's peer review as synonymous with quality. So they independently assess the quality of the included research. One of the other interesting developments is we're now not just seeing these living evidence syntheses in the form of global public goods. So what I mean by that is a synthesis dealing with a question that everybody in the world can then use to access the most updated evidence. But we're also seeing living policy briefs start to emerge. So on issues that are likely to take many, many months or perhaps years to fully address, we're starting to see people now prepare a living policy brief that gets updated every few months as an input into a living stakeholder dialogue, where the same group is brought back periodically to continue to address a problem, to reflect on what has changed since their last meeting, and to plan a way forward. The final thing that I'll say about the evidence support system is we need to use the right strategies to support the use of best evidence for the right issues and contexts. And in today's workshop, we're focused on 2 rows in this table. So I'm talking about policy briefs, as Mehrnaz has been. They involve integrating different forms of evidence into timely, demand-driven, contextualized, ideally equity-focused evidence products. So again, forms of evidence like data analytics to clarify a problem and its causes, evidence synthesis to describe the likely benefits and harms of an option to address a problem, and behavioral science to develop an implementation plan. Shortly, Fadi will be talking about policy dialogues, which are another very important strategy. And typically these 2 strategies are used together. So our group, like many others, always does a combination of policy briefs and policy dialogues, not usually just one of those alone. So there are three topics in particular for this session that I wanted to go through. And the first is about identifying priorities and requesting policy briefs to address them. And I have 4 questions on this call for you to think about if you're identifying priorities and requesting a policy brief. So the first question, is there a meaty issue, particularly about strengthening the health system or about getting the right programs, services, or products to those who need them? Our experience is sometimes we're asked a very narrowly defined clinical question, like should we consider this very particular new service for diabetics, or a health technology topic? Should we pay for this new technology? Our view is that there are other methods that are even better suited to those types of questions. And I think one of the many strengths about EMRO's approach to supporting evidence-informed policymaking is it's looking at all of the relevant tools to support decision-making and encouraging you to match the right tool to the right need. Policy briefs and policy dialogues are particularly good, in my view, when it's that meaty issue that has to do with, again, strengthening the system or getting the right program, services, or products to those who need them. The second thing to keep in mind when you're deciding whether to ask for a policy brief is either, is there an opportunity to get a new issue on the government agenda, or is there an opportunity to inform a policy decision? So if the government has already signaled their intent to do something, but hasn't yet decided exactly what to do. If it's the former case, we often say that to get on a government agenda, you need 3 things. You need a compelling problem, you need a viable policy, and you need conducive politics. And a policy brief can help with those first 2. It can bring together the evidence to make a case about the nature of a compelling problem, how big it is, for example. It can also bring together evidence to make the case that a policy option is viable. So as Mehrnaz said, to show that it's safe, it's effective, it's cost effective, it's feasible to implement, and it would be sustainable to keep in place. So policy briefs, very helpful for 2 of those 3 Ps, the problem, the policy, and then you need to be attentive to the politics. Is now the right time given everything happening in the country? If the issue is already on the agenda, but a decision hasn't yet been made, and you have an opportunity to inform that decision, then the evidence brought together in a policy brief can help to clarify the problem and its causes, and it can help to frame options to address the problem, and also ideally identify implementation considerations. So again, if it's on the government agenda, the policy brief can bring the evidence that helps with those understandings. You would be the best judge of the bigger political context. Are the institutional constraints, interest group pressures, values, all the other political considerations, might they provide an opportunity for a particular approach that the evidence suggests might be useful? So again, the policy brief isn't meant to answer all the questions about politics, but it is meant to bring the evidence into that political context where it can then be considered alongside these political considerations. The third thing to think about when you're deciding whether to ask for a policy brief is there, or could there be, with EMRO's support, a team that understands your context and has the capacity to respond to your request? We often say that to work for a team like ours or to work for a team like Fadi's, you need 5 types of capacity, but 4 are particularly important for the policy brief. You need to be able to synthesize evidence. So you need to be able to identify it, select the right types of evidence, appraise it, and then synthesize what it means for the decision. You also need policy analysis skills, so that ability to understand a policy problem, policy options, policy implementation. And because often you're dealing with meaty questions about strengthening the health system or getting the right programs, services, and products to people, you need good systems analysis skills. So you're not starting with a clean slate. Your health system already has a number of governance arrangements in place. So certain people can make certain decisions. You have financial arrangements in place, so money flows into and through the system in particular ways. And you have delivery arrangements in place. So doctors play particular roles, hospitals play particular roles, and you need to understand those system arrangements so you know what the current situation is, and then what you might want to change in order to make improvements for the better. The fourth type of capacity that can be very important is political analysis. And that's those questions about, are the politics conducive? Are the institutional constraints, interest group pressure, and so on supportive? But of the four skills, that perhaps is the least important for the outside team, but those are hopefully skills that you have yourself. But the team needs to be able to synthesize the evidence, analyze the policy, and understand how the health system currently works. The fifth type of capacity that we talk about is stakeholder engagement, and that is the piece that is absolutely essential for the policy dialogue that Fadi will be talking about soon. And then the final question for you before you commit to request a policy brief is, can you commit some time to work with the team for a scoping call to talk about the scope of the work to be undertaken? Are there certain dimensions of the problem that cannot be addressed currently? Are there certain policy options that just cannot be on the table currently? So that initial touch point is key. Can you commit to periodic calls of a steering group that will help to make ongoing decisions as the policy brief is being put together? And can you commit to provide feedback on the draft? We often say to people who want to work with us on a policy brief is, you tell us how long you have. You may have a month to prepare, you may have 2 months to prepare, but over that time, from the moment you first contact us until we have completed the policy dialogue, we would need about 10 hours of your time. Sometimes it's a brief 30-minute call. Sometimes it's 45 minutes providing feedback on the policy brief. So our experience is when people ask us a question, they need to be able to commit some of that time to help the team to make sure the policy brief is as helpful as possible. So those are some considerations when requesting a brief. Is it a meaty issue? Do you have a chance to make a difference in decision making? Do you have access to a team that can help you do this? And can you commit some time yourself to make sure that the team frames everything in the most helpful way and produces a policy brief that is fit for purpose? What we'd love to hear from you is, what would be an example of a topic that would benefit from being addressed by a policy brief in your country? So many of you weighed in with introductions, who you are, where you're located. Could you just take a few minutes while I continue talking to give an example of a topic that is front of mind right now in your country that you think would benefit from a policy brief and hopefully also a policy dialogue? That will give us a sense of the types of issues that you're grappling with. What I've done while you're thinking about that, I'll just review the 4 policy briefs that we are currently working on at my home unit. And it's funny, in a way, they're not representative of the usual breadth of issues. They just reflect issues that are top of mind right now during the ongoing struggle with the COVID-19 pandemic. So the first is creating resilient and responsive mental health systems for children, youth, and families. So COVID-19 had devastating impacts on many children, youth, and families, long periods of lockdown, job losses among parents, children not being able to attend school. And so how the health system works for children and youth and families struggling with mental health concerns has been top of mind. The second, using remote monitoring and associated technology to enable people to stay in their homes or at their existing level of care. Many of the people who died in Canada during COVID-19 died in long-term care homes. Many Canadians now feel very strongly they do not want to end up in a long-term care home. So we have an explosion of interest in remote monitoring and other technologies that would allow people to stay at home or at least not have to go into a long-term care home. The third one, again, is telling about where we are and have been with COVID-19, an explosion in the use of virtual care. So many fewer face-to-face visits, a lot of interactions with health professionals happening through technology. And now the question is, what is the right balance? So we went from almost all in person to almost all virtual for ambulatory care. What is the right balance as we shift back? When is virtual care better? When is in person absolutely essential? And then the final challenge, again, a reflection of COVID-19, we have a massive and growing health human resource crisis in Canada. Many health professionals retiring after struggling for the last 2 years with COVID-19, struggling because of huge backlogs in surgery and other things brought about through COVID-19, many challenges. So this is the fourth topic. So again, these are not typical topics in a way. They're, illustrative of a type of product, but because of COVID-19, all of these reflect the ongoing impacts of COVID-19 and efforts to figure out how do we get back to a new normal with our health system. But please do be putting examples of topics into the chat box that are front of mind for your country. So the second major thing that I wanted to talk about was assessing the policy briefs you receive. The most important question is it a policy brief in the sense we mean by a policy brief? So Mernaz did an excellent job in describing what EMRO and WHO more generally conceives of as a policy brief, but many people use the language of policy brief. So you really need to check first, is this actually a policy brief in the sense being described by EMRO? So I have here some of the characteristics of a policy brief. So first, it describes 4 things: a decision-making context, or to use Mernaz's language, the justification for the topic. Second, it describes a problem and its causes. 3, it describes options to address the problem, including their advantages and disadvantages. And Mernaz very helpfully introduced language around safety and effectiveness, cost effectiveness, feasibility, sustainability, all of which could figure in that assessment of advantages and disadvantages. And ideally, there would also be some talk about implementation considerations. What we have found over the years, now doing preparing policy briefs for the last roughly 12 years, is while we almost always look at options, there have been times where the steering group, so policymakers and system leaders who asked us to write the policy brief, said, instead of options, we would like to talk about the elements of a comprehensive approach to addressing the problem. So instead of choosing between A or B or C, they wanted to hear about A1 plus A2 plus A3. So 3 elements of a comprehensive approach. Our view is a policy brief can be flexible enough to accommodate that view. If options aren't helpful, then what would be elements of a comprehensive approach. The second thing a policy brief should do is incorporate both national evidence, or if you're working one level down from the country, the state or provincial level evidence, and it should draw on syntheses of the best evidence globally. And for the national evidence, as I spoke about before, the team may be looking for data analytics, maybe looking for modeling, maybe looking for evaluation studies, maybe looking for local behavioral and implementation research, and maybe looking for qualitative insights. Ideally, they're looking for all of those things. The next one, I have an asterisk before it because this varies a lot by country. So in our country, it is not perceived as acceptable to make recommendations. So the view held by many policymakers and system leaders is they want us to tell us what the evidence says. They do not want us to take the next step and say, you should do this. And the policy brief is typically an input into a policy dialogue where many different stakeholders will look at that evidence, but they'll also consider all of the other political and system considerations. And they may go in a direction that isn't purely evidence-based, but may be more politically viable or more feasible in the system. So we do not make recommendations, but in some countries, it is acceptable to make recommendations in a policy brief. The fourth thing to look for is the team using a systematic approach and reporting the approach transparently? Fadi, Arash, and Mirnaz should correct me if I'm wrong, but to my knowledge, there's still no formal standards for policy briefs. So I'm aware of work underway by the right team in China and by some others to try to develop standards, but we don't have a simple rating system as we have for systematic reviews to judge how systematically and transparently a policy brief was conducted. That is something that we think we'll see in future. The next thing we always look for is, did they use what we call a graded entry format? So a way in that if you only have a few minutes, you can grasp the key insights. Those are the key messages that Mirnaz referred to. Then the main text, which still needs to be relatively short, as Mirnaz indicated. And then if there's a lot of detail, including about the methods, they can be pushed to the appendix. And then, as Mirnaz also indicated, we need to see acknowledgements, statements of conflicts of interest, and a reference list. One that I don't think Mirnaz mentioned, we always look to see whether the policy brief was subjected to merit review. So peer review is review by researchers. Merit review is a term we use when it is reviewed both by researchers and by decision makers. So that's something else. And then these last pieces are optional, but in many countries, people will include an equity focus explicitly. So when they look at the evidence, they'll say, is the problem bigger or worse or different for different groups in society? Might the options have different benefits and harms among different groups in society? Might there be particular implementation challenges in different groups in society? I mentioned looking at the quality of the evidence, and for those global evidence syntheses, how applicable is the evidence from other countries to your context? So the items that aren't bolded are what I think of as the key features of a policy brief in the sense that we mean them in today's workshop. And one day soon, we will hopefully have explicit standards that will allow us to assess that bolded item. How systematically and transparently was the work undertaken? So I'm almost done. My last topic, just briefly, is how can you use policy briefs? And I think of there being three main ways that are useful to decision makers. First, they will help you strengthen your communication about a problem and its causes. So they will help you work through if we are having significant problems with mental health among children and youth, how big a problem is it? Is the problem getting bigger or smaller over time? What are the potential causes of that problem? How many relate to school shutdowns? How many relate to parents' job losses? How many might relate to other issues in society? So having that evidence is really helpful when you're communicating to people about a problem and its causes and trying to encourage them to pay attention to the problem. Second way a policy brief can be helpful is in helping make decisions about potential policy options. So that's the second part of the policy brief. And again, can be very, very helpful for people to say, okay, we initially thought this was the problem. We were thinking about this policy option. You've now brought to our attention that we could pick two other options. Now that we see all of the evidence, we think we may want to go with, let's say, option 2. And then the third, and in my view, the most important use of policy briefs is to engage stakeholders in discussions about problems and options in the form of a policy dialogue. And that's what Fadi is going to address next. So we always use policy briefs in conjunction with a policy dialogue, but they can be used alone. And when they are, they're still helpful for those first 2 bullet points. So if you want to know any more about some of the insights that I provided today about the evidence support system, which to me is the bigger system in which policy briefs get used, you can find the Evidence Commission report. It's available in Arabic, thanks to our colleague Fadi El-Jardali and the Knowledge to Policy Center at AUB, and we're very grateful to them for that. And it's available in a number of other languages. And I'll just close by saying now seems like the best time in the 25 years that I have spent trying to support evidence use by policymakers to take actions to strengthen evidence support systems. So you'll see the 5 reasons here: a cadre of political leaders with experiences we can build on, many innovations we need to be leveraging, lots of lessons learned. I've learned more in the last 2 years about how to support decision-making than in the previous 23. Many COVID-19 evidence investments are coming to an end. If even a fraction of that money was spent on supporting networks like this one, we would be in a better place. And we have many health challenges to address.
Now I want to invite Dr. Fadi El-Jaradi, Director for Knowledge to Policy Center, American University of Beirut, Lebanon. Thank you.
What I will be actually speaking about, just to build on the great, I think, messages that came from the John presentation related to the policy brief, the use of the policy brief, and to what extent this can inform discussion, debate, but also shape decisions. So I'm going to talk today about the policy dialogue. I will reflect a little bit on the experience that we had at the K2P Center, because we have been involved over the last, I would say, since 2015, in several policy dialogues that we tackle different areas and issues related to health and social care system. We'll reflect a little bit on that experience. And I'll try not to take much time, because honestly, I would actually like to have this, hopefully, engagement throughout the workshop with you, and maybe also to discuss and reflect on some of the questions that you would like also to raise, including the priorities that John already mentioned, and how we can maybe chart the way forward in terms of next step. I think this is an important intervention, important workshop today, but this will be hopefully the basis for what can come next and how you can really see, benefit directly to your own context, your own country as a result of the work when it comes to policy brief and policy dialogue. Let me just go directly. And I think one of the things that I want to start from is that over the last 9 years, we've worked a lot with different policymakers, with different ministries. And I have to say, all the time, it happened that whenever there is a new evidence or there's a policy document or even a policy brief, in many cases, policymakers don't have the time to read everything in the policy brief, or at least actually understand the latest evidence on particular issues. As you know, people working in ministries and different organizations, sometimes they have to make a quick decision, rapid decisions. But I have to say, with the engagement that we have done in many countries in the region, I haven't seen a policymaker saying, no, I don't want to be kept up to date with the latest evidence. I don't want to actually see what is the latest evidence that can be adapted, contextualized in my context. So in fact, all the time, policymakers, stakeholders actually welcome new innovation of how we are actually informing, shaping, translating the evidence that we have locally, regionally, and internationally to actually come to bear to help inform, shape their decisions through policy options, etc. So I think we have a great, in fact, momentum in the region, particularly what we have learned from the COVID-19. And I, like my colleague John, I've learned a lot personally also over the last 2 years, where we have done, we produced more than 25 documents that are, a rapid response document focusing on evidence of informing the government of how to actually address, deal, and react and respond to the COVID-19 pandemic. So policymakers under tremendous pressures, they want to make sometimes rapid decisions. They want to have access to the best available evidence in a user-friendly way. But also, many of the things that we've learned from COVID-19, many of the decisions require coordination, negotiation, I would say deliberation across different stakeholders, particularly that when it comes to health. It involved many ministries. For example, now I think I looked at the chat box about traffic accidents, lanes for bikes, non-chemical diseases and others. You will see that these require intervention and engagement of different stakeholders beyond the usual suspect, which is really Ministry of Health. Many of the countries now in the region, you'll see that they are embarking in state-led reform, not only reform led by Ministry of Health, state-led reform. We look at Egypt with the universal health insurance. We look at Saudi Arabia with the mega transformation, with the health vision. In addition to other countries in terms of actually transforming the system as a result of the COVID-19. So we have this is a timely discussion. I just wanted to mention that it's a very critical. Actually, maybe we can build it out. So quickly, just briefly, so we are a center modeled actually after the McMaster Forum that is led by John Lavis. We are a knowledge translation platform, and our work is really to work at the intersection between evidence, policy, and politics. And we focus mostly on how we can really provide context-specific solutions to complex policy issues. I would use the word that John mentioned, meaty and high priority policy-relevant issues, but also work on convening high-profile policy dialogue in terms of we are designated as the WHO Center for Evidence-Informed Policy. Now, we mentioned, and I have to say, when I say knowledge translation products, there's many products. There's the policy brief, there's the rapid response, there's the brief, but certainly in this workshop, we're focusing on the policy brief, which is, I believe, the most extensive one. But I have to say, from the experience that we have, policy briefs are very important, but sometimes not sufficient in terms of informing and shaping and impacting decisions. So that's why in many cases, when the opportunity comes, we actually make sure that we convene a national dialogue or a series of mini dialogues that allow the uptake of the evidence that is coming from policy brief. And let me give you an example. For example, now we're starting working on and this is with the request from the minister, we're working on the financing options for primary healthcare. As you know, with the COVID-19 now, more and more attention going to primary healthcare, particularly in the case of Lebanon, just because of the economic depression now, more and more people are not able to afford the hospitals, which in fact reinforce more the role of primary healthcare. But we thought this is a window of opportunity to start, reforming primary care. So in this case, so you need a very good comprehensive policy brief that defines the problem, the causes of the problem, as John and Mehrnaz mentioned, that look at the options in terms of benefits, harms, cost effectiveness, implementation consideration, stakeholder reaction. But if you want all this evidence that is contextualized to make an impact, you need to bring it into a deliberative meeting where you engage all the stakeholders involved. As you know, in Lebanon, you have the primary care centers are mostly, in fact, owned by NGOs, civil society groups, faith organization is not only the government. So you need to actually bring all the stakeholders around the table and actually work with them to realize that this is a problem. There is a more of a consensus in the problem and the causes, but also help them discuss and co-produce and relate to the options and the evidence provided so they can actually impact or make a collective decision on this. From my experience in running policy dialogues, I've facilitated many policy dialogues like John, and I have to say I've always learned. I always learn, and sometimes we might think that everything we put it in the policy brief before we go to the policy dialogue, but in many cases there is a lot of tacit knowledge that policymakers have. Not everything is written, not everything is published, and the only thing sometimes to unpack that and to unleash the potential, I would say, from many of the stakeholders that are really informed, is to engage them, in fact, and show them the evidence and tell them this is not the yes, it is a one-stop shop document, the policy brief, but this is not this is not written in stone. There's always an opportunity for improvement, co-designing, co-producing some of the options, crafting some of those options based on what we put. So certainly we have seen, we're talking from experience because many of the decisions that we were able to influence was as a result of a policy brief and policy dialogue together, not only a policy brief, and it depended on, of course, in this case. So certainly, evidence that is coming the policy brief is very important, but it needs to be contextualized. This is a policy brief is a decision support document that is provided and hopefully written in a way that is simple, user-friendly, based on pre-appraised evidence, high-quality evidence, locally, regionally, internationally, but also contextualized, meaning it relates to the context that you are really working. So this is very important. That's why we engage with a wide set of policymakers. So yes, it is the dialogue. It brings together different stakeholders, and I'll show you some examples. In many cases where we had different ministries around the table. Health, education, finance, social affairs, but depending on the priority issue that we are really addressing. But certainly, as John mentioned, the pre-circulated, when we do policy dialogue, we send the policy brief at least 2 or 3 weeks to all the participants. And in fact, we follow up to make sure that they receive it. And so they can, and we encourage them as much as possible to read it. And we make it, and we say that even if you are not able to read it all, we try to put key messages, a few pages where actually, in a few minutes, people will be able to understand everything that is being written in the policy brief, from problem to options to to implementation. But this is very important. What we tell them that this is where we need you at the policy making, at the policy dialogue, where we actually more reflect on your views, listen to your views, your experiences, and they like it because you're not parachuting evidence over them, say, okay, this is the best way to do it. No, you're actually providing the best high quality pre-designed, pre-appraised evidence that give a certain options of how to tackle a particular issue or elements of comprehensive solution, like John mentioned. But at the same time, you're allowing for that deliberation. And I think the best way to do is to make policymakers actually realize the evidence that is being already put in the policy brief, but at the same time, let them listen to each other. Then I think about this dialogue, and we have a lot of testimonials when we evaluated many of those dialogues, and we always hear that this is the first time all the stakeholders are speaking in the same way about the problem. This is the first time that we have one-stop shop document that give us everything that we know or we should know about the problem causes, indicators, size of the problem, and the option. This is the first time we actually try to discuss and negotiate how we can work on that. This is the first time we try to actually, have a distribution of labor and division of labor, who's doing what after the dialogue. So it is really provide an opportunity to discuss, contextualize, and determine next step. So again, as I mentioned, the key features of the policy dialogue, certainly it has to address high priority issues. In the words of John now mentioned, meaty issues, really very, very critical one. And I have to say now, knowing what's happening in the region, I have to say that most countries now, they are identifying really high policy priority issues that need to be tackled at the intersectoral level, not only at the level of health. So you'll see a lot of intersection between health, social affairs, economy, finance, etc., in many of the issues. And this is the result of the COVID-19. But certainly it provides opportunity to discuss different features. So that's why it's a very, focus group is not a meeting, just tell me what you think. This is a very structured meeting that we go with very clear agenda, that we have a segment of that day on defining the problem. We make sure that people are clear in the problem and the causes before we go to options. and next steps. So it provides an opportunity to discuss options, provide opportunity for stakeholders to discuss implementation issues, but also this is the most important thing is that, again, you bring it all in one document. You bring together the many individuals who are really involved. They are primary stakeholders. So that's why it's very important to have the right people around the table. We work very hard, by the way, to make sure that, because the worst thing could happen is to do high-level meeting, policy dialogue, not having the right representation in terms of, because it might fire back. But certainly making sure that this deliberation or dialogue is facilitated effectively. I'll talk briefly about that, and to actually making sure, not necessarily aiming for consensus, depending on that. Some cases, by the way, we ended up with a dialogue leading directly to a consensus. Everybody was agreeing on the next step, and in some other there was actually some divergence, but at least agreement of how this would be taken forward. Certainly when it comes to impact, we have a lot of examples about the impact as a result of the policy dialogue. So this is where we had an example, and we documented this in case studies. We don't have time to go over this, but this is also from what has been written on this. So policy brief, policy dialogue are well received in many countries. They tend to view the policy brief and deliberative dialogue very favorably, and this is based on policymakers' perception, and also had a direct impact on policymakers' stakeholders' agendas. So at the level of policy development or implementation, we've seen it in many countries, including where we work, and definitely led to strong intention to act among dialogue participants. Certainly, the timing is very important, and as John mentioned, yes, we many times we use policy brief to influence the agenda of government. We always, of course, whenever you have a new election or that there's a new government will be formed, this is a perfect opportunity also to push for a few things to be put into the agenda. But certainly, policy brief, policy dialogue support policy making process, from agenda setting, of course, throughout helping with problem definition, deciding on the instrument, but also on the implementation. So yes, they are. We had a case, for example, we were able to integrate patient safety indicators and change the accreditation system only from a case related to medical error. So we use it actually to set the agenda and actually influence the priorities. But at the same time, when it comes to policy implementation, we were able, through a policy brief, policy dialogue, to also change laws, stop the implementation of those laws because we realize it's harmful, but also to make sure that we have an effective implementation of policy decisions. So it's really across the board. This is just example of what we do, just to make it a little bit much more real. Again, it's all about how you make sure you have all the right stakeholders, really the decision makers, not the decision takers, the decision makers around the table, how to make sure that they are actually have access to that policy brief, and they have actually read it, understood it, and how to facilitate the meeting to ensure that the policy brief is used as the main input into the discussion. And I think this is very, very important in a very structured meeting that would lead to a decisions. We have a lot of examples. I'm not going to go into this, but just to make sure that, yes, those meetings require a lot of, we produce a lot of policy brief, conduct dialogue, we produce a brief note and others. But I tell you, all people think, oh no, policy dialogue meeting is so simple. No, in fact, we put a lot of efforts and time also similar to actually doing the policy brief, because we want to make sure that we have the right stakeholders. We have a high quality policy brief, and we do evaluation of those internally, of course, just to make sure that it meets certain criteria, because you cannot send a document that is not finished or is problematic to policymakers, because you want, the worst thing is to actually lose trust, because policymakers at the time of decisions, they want a trusted source of evidence. They wanted a document that gives them really more a confidence in terms of how this evidence is being synthesized, analyzed, but also how it's being used in the political system. We always even take note even with the seating arrangement, because with some stakeholders you have to be careful in terms of some people, unfortunately, sometimes, well, in reality, you're not necessarily, some people in fact speak or make comment based on where do they sit, decide who they will sit or facing who they will sit, depending of where there's issues, because many stakeholders, they have different interests sometimes, and sometimes there's conflict or issues and tensions. So we always make sure that we do power analysis, we understand the stakeholders' background, their positions, how they come, and then we make sure that we put the right environment for them that actually can arrange for this. Now, again, we have different products, but we've done. I'm talking mostly on policy brief, but we have also a briefing note where it's the same as policy brief, but we provide recommendation rather than options. And sometimes, policymakers ask us, we want a document with recommendation, not an options. We present, lately we innovated a lot, so we present the evidence. I know people sometimes don't have time to read a brief, so sometimes we use a lot of visualization. We use animated videos to how, for example, when we've done about disability among children, when we've done about childhood obesity, when we've done about child protection strategy, we had to actually put that because there was many, I think there was around 8 or 9 ministries around the table. So we've done actually videos, animated videos, to actually more summarize what we put in the brief in a very 7-minute video that the people can actually understand. We use infographics, presentations, and we actually have, certainly we give them the policy brief before the meeting. So, also about, again, this is just an example, for example, when we've done policy dialogue in different topics. So usually we make sure that it's inclusive and involves fair and balanced representation of stakeholder experts. From our experience, usually 18 to 25 people is enough to ensure that you get the best out of those stakeholders, to allow them actually to discuss. We allow frictions among ideas, but not among people. So it's very important for the facilitator to actually engage as much as possible. Of course, we select stakeholders based on their degree of involvement and knowledge about the problem, ability to engage in discussion and articulate the problem, ability to champion action recommended from the dialogue. So we always make sure that this person has the ability to act later on, a representation of a range of interests and experience and perspective that can inform on the political, economic, and also the realities of implementing the policy, whether they have a role in implementation. So yes, we involve and engage policy implementers, and we make sure certainly we have a balance across part of the countries, provided groups and gender taken into consideration. So we work on that. This is an example of we try to make sure that we know who are the stakeholder and their position before we invite them. So we always look at who's affected by this particular problem, who has a hand in a solution. We look at all the influencers, and that's why, in our system, there's a lot of, it's a pluralistic system. There's a lot of engagement and power and influence of NGOs, civil society group, private sectors, advocacy group. So we make sure that we actually also engage all the influencers, and at the same time, certainly policymakers and decision makers across different levels, from government and non-government, including syndicate, association, municipal. Again, we're not saying that it's all of them will be invited, but I'm trying to say that for each topic, we make sure that we know who are the stakeholders, the primary stakeholders that have a stake in that, and what their position, and that we can actually identify that. So that's why in our sampling framework, I'm not going to go into detail, but just quickly to tell you that we have certainly a fair representation from policymakers, manager institutions, community-based organizations, healthcare providers, of course, researchers, because the nice thing about policymakers, they like as well to know evidence from their own country. So sometimes it's very important to also harness and leverage on local evidence, not necessarily only looking. Of course, we look at systematic reviews, we look at all the high quality evidence, we look at the experience of other countries, but also they would like to see and know what actually exists or happening in their own context. So we work very hard to do that. And in the dialogue, actually, some of those additional things about the local evidence will come up, and we are actually welcoming to that. And they like it because we want to harness all the kind of evidence that is really there. Of course, sometimes we engage citizens, or at least consumers that are affected by this. And we're not going to talk about citizen panel. This is also, we do dialogue, and we've learned a lot from the McMaster Forum about the citizen panel they do. This is where we only do the dialogue with citizens. This is example of, I'm going to go very quickly. For example, when we've done a policy brief of how to promote immediate access to essential health needs for Syrian refugees, we had to include 25 diverse stakeholders. And if you realize here, there was a lot of UN institutions, because they were actually, or donors and funders and humanitarian aid agencies, because they were involved, in fact, in the response. We had to have people from Ministry of Social Affairs, Ministry of Health, local NGOs, and healthcare providers. When we've done about preterm deliveries, also we had to include the type. So what I'm trying to say, every topic you work on in a policy brief, it has a selected set of stakeholders that actually should meet the criteria of, they have a direct stake, they can influence, they can have a role in the implementation. This is very critical to identify the right stakeholders. The worst thing could happen that when you have a good policy brief, but not brought to a policy dialogue that have the right and fair representation, because sometimes that's why I mentioned, even we make sure that we work on the seating. So it's very important. Sometimes we don't put two stakeholders facing each other if there is some tension, or they have different position, statements on the same issue, or they have some conflict, because this will lead to a debate rather than dialogue. So we want to make sure that we always work on the seating and make sure that everybody is really quite the environment that we are actually providing with the dialogue allow everybody actually to contribute. And this is where, in fact, again, this is just an example of some of the work that we have done. The one thing I want to mention as a facilitator, be careful that dialogues also need to be facilitated by, and I always say that dialogue facilitator can make or break a policy dialogue. A facilitator should have understand the context, including the participants. They have to understand the local system. They have to be familiar with the topic. They may not be an expert in the topic, but they have to be familiar with the context and the topic. They have to certainly understand the internal, I would say, local politics, respect the policy dialogue process, including the preparation, and be well prepared. That's why I'm saying 80% of the effort, in fact, is made prior to the dialogue, because once you come as a facilitator, knowing everything you need to know and well prepared, you can easily facilitate. So that's why, and maintaining the 80-20 rule, where participants should be able to talk for 80% of the time and facilitate for 20%. So making sure that you get the best engagement from the stakeholders. Of course, exercising a different sense of skills. So basically in conflict resolution, managing the politics, we always actually hear that. That's why we always at any time, we disclose, as Mehran has mentioned, if there's any conflict, we always disclose, the sources of funding, what the reason why we're doing it, etc. The good thing that we are an academic institution. So these are things that already been sorted out right from start. So the opening of the dialogue is very critical. So we're very transparent, with the introduction, brief overview of who we are, and then we disclose any potential conflict of interest. We provide a clear introduction to the topic. And by the way, this will increase the trust of the people around the table, by the way. And this is what we've learned. The more you are really upfront, the more you're structured, prepared, and also transparent, the more you'll see engagement and also improve trust. You actually talk about the purpose of the dialogue, the rationale for selecting the participants. And because sometimes I've seen in some dialogues, some people raise hands, why the media is not around the table? Why this person? We always go with the process of how those people were selected and why. And we make sure that we outline the rules of the policy dialogue. That's why making sure, and that's why we use the Chatham House rule, so we don't associate any statement with any name. And in fact, people feel much more at ease, and sometimes they take out the hat of a person coming representing a ministry to a hat of really being 100% socially responsible to address, discuss, engage, deliberate about the issues, because everybody had an interest in the solution. So this is very important in terms of this. We don't allow media to come in because this is really a closed meeting, but certainly people after the dialogue can actively speak to media, or sometimes we do press release, whatever, but not at the level of during the dialogue. And we don't aim for consensus. So we never force a discussion to go into a consensus, because we know it might fire back at the level of implementation. So we make sure sometimes automatically discussion and the dialogue will lead to a consensus, but we never force it. And in some cases, we agree on a concrete set of actions in terms of the next steps. Yes, there are some issues with conflict of interest, sometimes competing ideas. That's why we make sure we know who are the people around the table. But we make sure that the input and the voice from all the stakeholders are respected, even if divergent, even if they have competing interests. So yes, sometimes conflict might arise and some tension. And this is where, in fact, at the dialogue facilitator would try to make sure that how we actually dilute this, how to make sure this is really, going according to the protocol for the dialogue, and making sure that there is no, if there's any mutual misunderstanding to be clarified. So certainly to deal with the conflict of interest, we do the power interest matrix. So we understand the power interest stakeholders before they come to the meeting. We understand their values, their perception. We might sometimes we expect what they will say, and we are prepared how we're going to respond. So it's very important you can make sure everything is really quite structured. We never take sides, by the way, as a facilitator. The minute you take side, you lose. I would say that you lose the battle here in terms of you lose at least neutrality when it comes to dealing with it. I think we engage and open with all the stakeholders. We make sure that we know about those background, the background, the achievement of all those stakeholders, and making sure that if they have any conflict of interest, that they disclose it as well right from start. So this is really more of this. But again, the key to deal with conflict of interest is to actually disclose conflict of interest, and at the same time to be well prepared for a structured dialogue meeting. Maintaining transparency and neutrality is very important, and making sure don't allow for 2 or 3 people to always take the lead in talking and hijack the whole meeting. That's why with effective facilitation, you get the best out of everyone, and you create that friction, as I mentioned, about ideas and innovation more than really friction among people. So that's why we try to actually engage and people that don't speak much in the dialogue, but we allow them to feel more comfortable and confident, and we encourage them to contribute. You will tell me, okay, what will happen after the dialogue? We follow up with the participant after the dialogue. We prepare a dialogue summary. So we promise them that we're going to give them a summary of all the deliberation without associating any statement to any name. And then they will update the policy brief based on some of the comment that they provide. So sometimes they provide some feedback, so we can revise. We evaluate the policy dialogue. We give them feedback on their evaluation, and we actually do a post dialogue survey a few months after the dialogue to see what has changed. And we ask them, okay, what is the first 1, 2, or 3 things that you have done as a result of dialogue? What are the 1 or 2 things, the changes that you've introduced? And we try to capture that. This is an example of the dialogue summary that we actually also provide. So we do a lot of post-dialogue activities, and sometimes we do another dialogue or another meeting. Sometimes, for example, in the cases where they ask me that, can you go to the parliamentarian, can you go to the parliamentary health committee and do personalized debriefing? Sometimes we do it. We go even, one-to-one with some key parliamentarians in order to advocate for some legislative change based on the dialogue summary. So there's a different modalities. The key here, what I'm trying to say is that policy brief and policy dialogue are tools to inform, shape, and impact decisions and impact policy. They are not an end in themselves. They are means to an end. That's why when we work on them, we always keep in mind the impact that we want to achieve. So we do backward mapping. We say, okay, this is the type of, in best case scenario, that's the impact we want to achieve. In worst case scenario, that's the impact we would like to achieve. And we work accordingly. So make sure when you actually, that's why we're excited to start that conversation with you moving forward, to start for you to identify those high priority issues, 1 or 2 that can make a difference, that you think can be impactful. If those tools can be utilized in the right way, and you will be able to demonstrate value and impact. The best way to allow policymakers to be a little bit more engaged in this type of discussion is to show them or demonstrate to them the value of this. And we have a lot of examples worldwide from all countries or regions that those tools are not really new. These tools are already now integrated in many of the, and institutionalized in many of the policymaking institutions. But the key is really also to make sure that you show impact. For the sake of time, I wanted to mention to you, like we have a lot of troubleshooting. Sometimes things might go wrong in the dialogue. I'm not going to go into this. But we have some, and we actually transformed it into case studies. Sometimes we have difficult people that come to the dialogue. Sometimes we have people that are not interested to change the status quo. We know some stakeholders, they benefit from the status quo. Some have issues with ministries or whatever, and they want to maybe hijack or ruin the dialogue. So we pass through all this, but yes, there are some issues. But all the time, make sure is that sometimes we get irrelevant contribution from stakeholders. Sometimes they want to drift the discussion in a different way. Of course, we interrupt politely if needed, certainly, and redirect the dialogue to the main topic. Sometimes there is tension among participants, so we try to make sure that we always refer them to the main purpose and the importance of accepting and understanding each other's perspective, avoiding getting defensive and engaging discussion that are really out of control. We always try to redirect the dialogue to the main topic. But all this to say that if you plan the dialogue very well, and if you engage and with the stakeholders in a structured, effective way, you'll always be able to actually get into a successful impact. And let me just say, I want to end up here, but just mentioning that with the help of AMRO, there has been a lot of studies that was and publication that was produced on the use of evidence led by AMRO with engagement with John, myself, and others. That's to show you that, for example, when we looked and surveyed policymakers in the region, and we surveyed ministers of health, previous former ministers, directors general, other stakeholders, they always say that in our institution, sometimes we don't have administrative structure to support the use of evidence in policy. Sometimes the communication networking between policy and researchers is important to facilitate the use of evidence, and also how to increase communication exchange between policy makers and researchers as potential strategy. This is also was produced through work with WHO AMRO, with Dr. Arash, with Dr. Mandil and others. And this is where we looked and we engaged and we, with all health research institutions that are involved in knowledge translation. I want to show you just very briefly to show you that, there is still the issue about policy brief and policy dialogue, and knowledge translation is not very much yet even integrated in many of the health research institution region, although there is now a lot of different models, very promising, of how different health institution universities are integrating knowledge translation, are also preparing and doing workshop and integrating knowledge translation in School of Public Health in order to allow, and others, in order to prepare the future cadres of stakeholders to be much more aware and knowledge about what this policy brief is, how to synthesize evidence, how to do policy analysis, how to understand the political context, and also how to engage with policy makers. So I'm not going to go into the example. We have everything in the public website. So we have a lot of example of brief and dialogue that we have done. But to show you that what I'm trying to tell you, that this works, and it had works, and it's working. The key now is how to take that learning, how to take that innovation in the case of Canada, in the case of the work that has been done by the Evidence Informed Policy Network, EVIPNet of WHO. Fantastic work has been done in many contacts, many regions. WHO AMRO, with the work that Arash and Mahrana are doing, is really groundbreaking in terms of integrating this into the actual policy making process in countries. What we're trying to tell you here, that policy brief, policy dialogue works. We have a lot of demonstration of how we can we start by, again, quote unquote meaty issue like policy, like John mentioned, and go into doing the evidence synthesis, producing policy brief or briefing note, bring it to the dialogue, and making an impact. This is an example of an impact we have done as a result of the Syrian refugees. This is, I mentioned to you about medical error, but we have a lot of impact. For example, when the government decided to legalize cannabis for medicinal purposes, we were able to produce a document that was actually used to actually shape the draft bill that went to the parliament, among other things. So there are a lot of examples that we have done. We have testimonials from many policymakers and stakeholders who participated in the dialogue. We don't have time to run it now, but in summary, what they told us, that policy dialogue certainly this is a demonstration of how really evidence can be brought to the hands of policymakers to inform their critical decision action. It is a catalyzing platform that brings together all the stakeholders and actually allow to deliberate about the relevant and different perspectives. Certainly the value to which policy briefs are prepared and systematically shared with all stakeholders. It is quite innovative, and this is what they told us in terms of how we start really, when we also shape the mental health strategy at that time, that several policy options, and I've heard it many times, they said, you know, we never thought that there are different ways of tackling this problem. We never thought that there is actually, you know, benefits, harms, cost effectiveness, stakeholder reaction to any of those options. We haven't thought that we have, you know, a high level of quality from systematic review evidence that actually can support us in that direction. So I think this is quite interesting. At the same time, they started, it is a platform, dialogue is a platform to bring all the stakeholders to listen to each other, to accept the different perspective, and at the same time to have a, you know, a common denominator, which is the evidence that it should be used as the jumping off point or an input into the way they are thinking about the problem and the action that will come as a result of that. Thank you so much.
And what I'm going to talk about is that, again, certain elements that could be potentially found in a policy brief, but even if they are not there, are important elements that you need to think of how to focus on them or how to complement a policy brief. Whereas also the case was in what Fadi was explaining. So my presentation, again, has several elements. So talking about appraising, interpreting policy options in light of country needs. I mean, on this, I did not spend an awful amount of time. I very shortly, especially because I mean, John addressed it really well here. So then talking about other available evidence in terms of different aspects, so referring also to policy dialogue there. Talking about recognition of barriers and facilitators, referring to managing conflict of interest, and also monitoring policy implementation and evaluation. So I'm going to sort of the photo that we refer to, just to bring everything in the context, integrated multi-concept approach, and through the processes. As Fadi referred, explained really well. So I mean, when we talk of knowledge translation processes, so I mean, we talk of policy brief as a tool is usually accompanied with different processes, policy priority setting. John was discussing that, and policy dialogue that we just heard about. So when we talk of the appraising and interpreting policy options in a policy brief, in a way, two main elements. Obviously, I'm not talking about the details here or methodologies. So making sure, I mean, what is in it is actually based on best available evidence. So that's appraising the method used, the evidence sources of it, and how is they being used, interpreted. More importantly, as a policymaker, is it really responding to my needs? This is especially key if you are not the person who requested the policy. So, I mean, sometimes as a policymaker or policy supporter, you find a good policy brief that you can use for decision making. So if you have not requested it, it does not necessarily answer all your questions, or it may be answering it for a different context. So it's really important to make sure you're spending enough time to understand the context of the recommendations, or if there is any recommendation, the policy options, the issues that they discuss, they may not even give you clear policy options, but they may give you a very clear analysis of, useful analysis of the problem, or how to make decision, or what consideration you should have, or implementation aspects of it. So you need to really bring that into the context of decision making. Even if the policymaker has deliberately requested a policy brief, it does not necessarily mean what comes to your in front of your eyes is answering all your questions. So such appraisal, that's the main purpose. So that's the first element, and also in the sort of our hexagonal, we put it on the top. So knowledge translation processes. But then there are two main sources of evidence that usually we expect to be used in a policy brief for a national setting. But if they are not used, you really need to think of how to complement those. So one set of it would be the data. We heard also from Dr. Hajar earlier the importance of data for national decision making and the challenges we have also for that purpose. So complementing policy briefs with further available evidence, the main source of it is looking at the routine data, health information system, national surveys, how they can shed further light for the understanding to help the processes. If you remember in the table that sort of the key 4 questions that Mehnaz was presenting earlier, so she was referring that the surveys and information actually can help quite a lot to answering the first question as well, which is a question referring to the issue of what is my problem, what is the issue. They can also help you to understand whether sort of the context is relevant to what you are seeing as a sort of deliberations in a policy, etc. So it's really important to look at that. But then obviously these sources of data should be available. So I'm not going to detail examples here, so we do not have much time for that. But I mean, imagine a policy brief addressing a certain disease, or let's say a certain problem, but they should become, well, I mean, so what is the magnitude of the disease? Is it being consolidated in certain groups of the society, certain geographic areas? How is going to be affected, or how the policies might affect that? So all of that, I mean, routine data might be a major source of knowledge for interpretation of the sort of any policy option you have in front of you. The second one, or the other element, would be the sort of ad hoc studies that are conducted, or you may conduct actually as a policymaker and use them. Also, monitoring evaluation. Later on today, in my presentation, I talk about how to monitoring and evaluating, or what are the importance of it when you want to go to the implementation phase. So you don't do, or we don't recommend policy briefs for nothing. So it's not just as a text. You have a policy brief, you do policy dialogue, you want to make certain decisions, hopefully, or you might to develop policies, you might have next steps. So if you have developed a policy, then you really want to see whether it's been implemented, whether it's been monitored and evaluated. Here, what I'm talking about is using the result of that to adjust your policies, of course, but then looking at the previous data that is coming from monitoring and evaluation processes that may be routinely done in a context of a Ministry of Health. Many such projects happen, and they can provide data for you for better interpretation of the evidence. So you can see that when we talk of integrated multi-concept, it's really to link different dots together, get help from them. I'm not focusing on HTA issue or guideline here. So these programs usually, if they exist, we expect that they are part of the development. If they are addressing similar question relevant to the policy brief, the evidence from them will be actually used in the development of the policy brief. So there are linkages at that stage. We covered this issue in detail in the previous workshop, which was talking about the methods. Okay, so the next question I'm trying to address in my short presentation here is the recognition of barriers and facilitators of this implementation in your country. So I try to use that with a real example, not real example of a policy, but actually a real example of identifying barriers and facilitators for an important policy. So imagine there is a country that is intending to improve the use of nurses in healthcare instead of doctors. What has been the problem, or what is the problem, is that, for example, we do not have enough money to recruit enough doctors. So I mean, nurses, the cost of recruiting nurses and maintaining them in the system is less. So that could be one argument. The other argument is that we do not have enough doctors, or doctors are not being adequately distributed. So we want to increase availability and sort of services. There could be also quality aspects. So I'm not focusing on that one. But sometimes certain services are actually offered better by nurses as compared to doctors. So there is evidence of that as well. But we call this in general as task shifting. So moving tasks from more specialized healthcare workers to less specialized healthcare workers with the aims that I mentioned. A Cochrane review was conducted a few years ago. So I mean, I was part of that review, and we were addressing this issue. And this review was conducted actually to help WHO to develop certain recommendations. So it was actually part of knowledge for the WHO recommendation series that came out, and it was published on task shifting. So what were the messages? So when we talk of barriers and facilitators, what we are talking about, because I mean, you can be very abstract when you talk of barriers of implementation, and then you say, okay, well, which barriers I'm going to focus? How do I know which barrier is important? But the examples are meant to help you on that. So, I mean, the key messages of the assessment was that, first of all, despite the sort of negativity that might be seen in many anecdotes towards task shifting, actually, when you go to the detail, you talk to doctors in details, nurses and patients, and these were studies, I mean, tens of studies from several countries around the world, and reviewing different aspects of it, high-income countries, middle-income countries, low-income countries. So it's based on a wealth of evidence. Actually, they accepted, especially if there are certain conditions being met. So it's also related to the type of service. So it may not be a good solution to every service. So then decision on, so when you talk of policy options, is that where to use it, how to use it. But then if you are thinking of nurses to do the job suitably, as you expect, there are also concerns from nurses' side, is that, so, well, if these tasks are referred to us, will we have enough respect and collaboration from doctors to do it? Is it properly resourced? Is there a good referral system? If I have a question, can I refer it to doctor? Will I have the support? Are there experienced leaders who guide me, to guide the program? Is role well defined in certain countries? For example, there are legal boundaries on what a nurse can do. So if I'm advising or giving a policy option on something for a nurse to be done, am I addressing those legal boundaries? Is there adequate incentive for the extra work? Do I have enough training? Am I supervised appropriately? So as you can see, so then this is a long list, obviously, and this long list is coming from the studies from different topics, different contexts. So it doesn't mean in your country A, all of these are a barrier, or if you remove them or you address them adequately or a facilitator. It doesn't mean that, but in a way it means the category of things that you are need to look at. So I use this example as the sort of precursor to my next slide, is that there are theoretical frameworks that help identify barriers and facilitators. I mean, several years ago, John and other colleagues have done some important work in this area, sort of bringing those frameworks that help you to identify barriers and facilitators. Again, another study, which again we did in support of a WHO work many years ago, was looking at the use of lay health workers in countries. And the main question was, why, despite all the evidence showing that lay health workers can be really effective in certain services, why countries are not using them enough? Why countries are not employing this cost-effective situation? So when we were addressing that and then think of barriers and facilitators of better use of lay health workers, obviously you need a logic model to, you remember the barriers I gave in the previous slide, these ones as examples. So then how they are affecting my logic model. So I want to enhance the use of lay health workers. I'm thinking of an objective or an impact or an outcome. What is my theory of change? What are the steps I need to follow? So a simple one in here. So a very, very simple, basic one. So let's, I need to think of my input program components. So I'm not using the generic terms here just to make it actually more sort of contextualized and meaningful, and the language of the programmatic language we use in healthcare systems. What are the intermediate outcomes? What are the long-term outcomes I'm looking for and potential impact? So if so let's say one of the components of a good lay health work program, and there's plenty of evidence for it from across the globe, and also several countries of our region in their experience, their selection criteria is really important. And one of the key selection is that select them from the same community. So that's an important lesson. So if you do this, what is your sort of logic model? So if I do this, what is the outcome? If they are from the same community, there is better relationship between the members of the community and the healthcare providers here, including the health workers, so the linkage becomes better. If the relationship is better, that helps us to provide further services for the patients, their family, to receive the services more easily. And obviously, if the service is a good service, then improve patient outcome. So this is my logic model. That's a good logic model. So then I need to try to use this criteria because I'm expecting this to happen. And these are based on evidence that I have. But then in logic models, sometimes we forget what we call, sorry, I lost this. Press the wrong button. Sometimes what we call the sort of the moderators or effect modifier. predict. That is, so selecting from community is a key criteria. But is it useful everywhere? Probably not. So for example, if you are dealing with a sensitive problem, sensitive issues, let's say, for example, you are discussing sexually transmitted diseases. In certain societies, could be mental health, or even some communicable diseases that there is a taboo against them in the society. So actually, when you have someone from community, it might actually result people not addressing or not presenting themselves to the health services because they are worried that, I mean, they are from my community, everybody would know about my problem. So then obviously this negative moderator effect might result breaking this link. I select from the community, but doesn't result in better relationship, and as a result doesn't result in long-term outcome. So this is the way we need to conceptualize. We need to think of barriers and facilitators and use that on sort of taking the content or policy options of a policy brief to the next step. Remember a good example that Dr. Khairandi showed us earlier? So the discussing policy options and then talking about the sort of the certain barriers and facilitators for that issue. You also saw the categorizations that Dr. Lavis showed us earlier. So again, this is a sort of thinking that would help. Ideally, if possible, we recommend such considerations to be considered when a policy brief is being developed. So when we are asking for it, it's better to ask for this, please consider these considerations. But if it's not, if I'm going to use it, if I'm going to assess it for my next step, these are the things I need to discuss. And if these are such discussions that usually people may not talk in the language I'm talking here, but in policy dialogues, when you present a policy brief, this is the way that different stakeholders come in. They highlight different aspects such as these. Again, you can synthesize the outcome of a policy dialogue using a logic model or a theory of change to help decision-making and implementation. One famous framework for this one is relatively old, but I mean, it has the main element. You can adjust it as well, is the Shore conceptual framework. So it looks as, I mean, when you, again, telling you that, for example, if you think of barriers, facilitators, the issues that affect implementation, think of recipient of care. What are the main elements? And the Shore framework gives you these key elements. So it gives you a long list of things to think about for providers of care, for other stakeholders. It talks about health system constraints. So what are the things you are concerned about or is important for you? Is the care accessible? I'm talking about, for example, certain medicine for treatment. Is the supply chain working in the society so that if I'm talking about this medicine, would that be a barrier, or can I be confident that if it is recommended by me as a policymaker, it will reach the users? And different elements. So as you said, it's a long list in here. And then also about the social and political constraint. I mentioned about some cultural issues, but then you can think of the ideological issues about certain programs. If there are donor organizations in the country, there could be corruption as a major factor. There could be the contractual agreement. There could be turf issues between different provider teams. So all of these they may affect. Again, does it mean that I need to address all of this? No. This is a framework that helps you not to miss key elements. So it helps you that you can think of those elements and then sort of use them when appropriate. Okay, now I move to the next item that I wanted to refer to. As I mentioned, for each item, I'm just quickly going through them because as a policymaker, you need to be aware of these issues. You need to be sort of having your eyes on them and also being careful that they do not affect your process of decision making. One important issue is the conflict of interest. It affects all processes of decision making. First of all, I mean, we need to ensure that the policy brief development is not affected by conflicts of interest. So we need to know, and we need, when we are asked to ordering it, to being careful who is involved. By who involved doesn't mean that people who are not in agreement with us, not at all. This is not about that. It's about the conflicts of interest that brings the interest of people ahead of interest of the society. which, for example, that if there are financial interests, maybe, if there are also some certain organizational interests, some of those interests may not be detrimental, but then what you need to do is that to balance them really well. For example, if you have one organization that says go to the left, so bring another organization into the discussion or development team that is also concerned about the right, so that they can challenge each other, they can talk to each other. Is the process transparent enough? What methods being used? Are the methods well used in a way that actually the conflict of interest management is well addressed, etc. But then when a policy brief comes forward, there is an issue of conflict of interest management after a policy brief is used for policy decision making. Again, who is involved in making decisions based on using a policy brief? Are we sure that the committee that we are having is not affected by conflicts of interest? How do we can sort of be managed? How can we manage that? Again, so there are certain guidance here to how to do that, but similar to what John said about development of policy brief, that there are not agreed standards, and this is, I guess, something that we all of us need to spend more time. Obviously, as Mehna said, we are working on a draft format for that. After the format is finalized, I mean, we will share with EditNet as a whole, and hopefully it might become a global, the basis for a global agreement on how to do that, at least within the work that we do within WHO and sort of the wider community that works closely with the WHO. Similarly, in management of conflict of interest, there are many guidance, but the sort of the general rules are not based on a sort of global agreement or set of clear standard. They are actually set of principles that you would follow. We heard about the issues in policy dialogue. So if we have more time, we have more time, and we were listening more to Fadi or anyone else who has experience of conducting policy dialogues. A big problem or challenge in conducting policy dialogue is that to manage conflicts of interest in the session. You need to be careful about it on who you involve if you and invite to the policy dialogue. Certain groups of people, you have to invite them, but you should also be aware that the conflicts of interest how might affect the process. And then also, I mean, to manage it during the session, a major role of a facilitator is to balance those, to ensure the policy dialogue remains helpful. And then something that we've actually highlighted very clearly in the technical paper of the WHO published in 2019 is that if we talk of any evidence to policy process, getting to a recommendation, if, for example, it's a guidance or it's a guidance or a technology assessment process, or if it is a sort of giving you options like a policy brief, it will not be useful if it's not at all considered by policy makers. So that's actually a part of important issue that needs to be done. And lastly, I go to the monitoring evaluation. Quick reminder, monitoring about the process, evaluation is about the impacts. I know in this terminology, people use them in different ways and they mean different things, so you should always be careful about that process. But then sort of, we need to know that most policy briefs, many policy briefs that are already published do not address monitoring and evaluation requirements. It's a good question to ask. Should they address it? I mean, it's a pro. I mean, ideally, if they do, and if, for example, they give policy options, saying that also what are the key indicators that you need to look at to monitor or evaluate the implementation of the policy or following its implementation. That's valuable. That's not a bad thing. But at the same time, you remember one of our key criteria is that policies should be focused, should be short, should address the key elements. So that doesn't mean you should not expect, even if they try to address monitoring, that you should not expect it to be addressing all your needs for monitoring evaluation. So it becomes something that you need to think of when you are dealing with the implementation of the policy after decision making. So the key steps on that. So, I mean, one question you need to ask, first of all, is it really necessary? Not every policy implementation needs a framework for that. The main reason is that monitoring evaluation is actually itself costly, takes time, takes effort, and sometimes doing too much of it or doing it unnecessarily for a policy that doesn't require that means wasting of resources. And we know that in healthcare, resources are meager and are not adequate for everything we need. Then what to monitor and evaluate? Which key elements we need to look at? Which indicators to measure? How often to measure them? What source of data to use for measuring them? And you answer all of those, and then deciding who is going to do that, and you have a monitoring evaluation framework for your work. As I mentioned, you need to do it very sort of consciously, making good judgment. I put it here as a note again. There is an opportunity cost for any monitoring evaluation project. So you will have immediate cost by that. The cost is money, the cost is human resource, the cost is attention and time. So make sure the cost is worth doing it because it gives you better outcome. If you are not sure, think through it whether the monitoring evaluation process is good or whether you need to adjust it so that it's useful for the policy-making process. So then about the indicators and measurement processes. So let's say, I give some very easy examples. So let's say we do a training program, like today that we are with you, we have and we will also learn from you in the discussion we are going to have, in the chat box comments that you have put there. So then usually when people talk of training programs, as we do also, you remember at the start of the session, I said we are proud that 19 countries have the senior representations in this discussion we are having today, which is excellent and shows that this is a useful platform. And then let's say later on thinking of sort of who is happy, who is not. So this is an outcome we can measure, we can report on easily. But is it the real intention of doing this? No. The real intention of doing this workshop is actually resulting in better policy review. And the real intention of resulting in better policy is as having better policies and better impact. As you see, the further I talk about what we really expect, is more difficult to measure it and more costly to measure it. So sometimes what we are really measuring and easy to measure is not really what we have in mind. Sometimes we have a good theory of change. We know that if this is correct, that the last thing is going to happen. But often this is not guaranteed. So we need always to bear that in mind. And again, the same logic model or theory of change I talked about earlier with some example will help you how to select monitoring and evaluation processes. So selecting the outcome of the right outcome is also important. The other element is that your outcome of interest may not be necessarily within your program. By that, sort of think of, very simple example. All of you are very experienced, so I don't need to give you an example, but just a quick one. So in your team, in your department, between your department, imagine that you are doing some work and then you want to intensify a team or an individual, you give them more resources. That's a positive stimulus. You want to see what is the result of my positive stimulus on the outcome. This is your program, that's the outcome you're interested in. But we also know by experience and by evidence that so you give support to one person, there could be potential negative effect on other teams and other people in your team. Not because people becoming jealous or because they are having negative reactions, personal attitude reaction. It's sometimes because that the negative could be because they feel that the area of work is not a priority. So you really need, when you are expanding program on one area, you need also to keep your eyes on other programs. But then how wide you go, depending how big is your program. And by that, I provide sort of a simple categorization. So if your program has direct objectives, limited program is always is adequate usually to just focus on the cost and effects of the program itself. If it is of medium size, a large scale program, I will give example. So make sure that you look at the closely related programs, as I mentioned earlier in my example. If it's a national policy, remember some examples Paddy gave earlier today. So let's say you are implementing a health insurance program, a health sector reform, you're revising your sort of human resource recruitment policies as a result of COVID. So then you need to think of what wide range of programs might be affected by that. So some examples, so health sector reform, UHC agenda, anything like that. Don't only focus on what is written in the program. You need to think of what other elements of the health system might be affected. A large program which is not affecting the whole system of healthcare, but large enough, so let's say you're incorporating mental health in PhD. Don't only focus on mental health element. You really need to think of what's happening to other programs in the PhD. Is it, but because of this program, is it having negative effect for communicable disease, non-communicable disease agenda, or positive effect, whatever? So you need to keep an eye on that so that a major program is not having negative effects on other agenda. That will help you to continue and have the right decision. And then lastly, if it's something very specific, let's say we want to increase hospital beds for a given service, usually it's better to focus on the cost and effect of that sort of service for the same program. You don't need to go much wider. So that's a rough guide, as I mentioned.
We have two questions, and I think that we can divide these 20 minutes for 10 minutes for each of them. The first question is, what are the key priority policy questions in one or more countries in our region that may benefit from policy briefs?
There were 4 excellent examples. All of them struck me as very appropriate to a policy brief. So one from Qatar was developing and implementing a non-communicable diseases surveillance system. I noted in brackets that this one might lend itself to that approach that I mentioned of 3 elements of a comprehensive approach rather than options. So if an NCD surveillance system is needed, it might be nice to have element 1 of a system, element 2 of a system, element 3 to break it down into manageable chunks. The second was reducing road traffic accidents in Bahrain. And initially, the individual had suggested developing bike lanes, but that to me is an option. It might be better to think about the general topic as reducing road traffic accidents. One option could be developing bike lanes, and the individual noted that there could also be specific strategies targeting young drivers. So it would be good to be explicit about what those specific ones are. Enabling collaborative governance within healthcare, hospital, sorry, it keeps jumping around every time someone posts something new, territorial groups in Morocco. That's an excellent one. And I noted our group has happened to have done a lot of work on collaborative governance. So if that's helpful to the Morocco team, I pointed them to a resource, but that would be a very rich topic for a policy brief. And the final one I phrased as getting the right treatments to patients suffering from genetic or rare diseases. So again, if it's about a particular treatment, then policy brief may not be the right approach. There could be other solutions like a technology assessment that would be more appropriate. But if it's getting the right treatments to many people living with genetic or rare diseases, that would lend itself very well to a policy brief. So those 4 that came in response to my question, I thought were all fantastic topics to address. And I just made some minor changes to how they're framed to optimize them for the policy brief method.
Thank you, Dr. Lavis. Also, we have some few suggestions. There is one from Dr. Ghada, strengthening the sustainability of HIV, TB, and malaria services and preparedness for transition.
What would like to, the examples John had selected are excellent. Just wanted to say, those examples also are very good to see how the context of the discussion we had today can help. So let's imagine the example of for Bahrain reducing traffic accident, and then you talk of the bike lanes. Just imagining if you have a sort of, let's say, policy dialogue on something like that, what do you expect to hear? So there will be people who will be very advocating for it, but there will be maybe driver teams or people with a sort of, which would not like it because they would think that would limit their driving capacity or behavior. There could be cost issues coming forward. There could be risk of accident due to the use of the cycling. It may result in the sort of urban planning processes. So you can see any major policy, and that's only one element of it. As John said, I mean, if you do a policy, if you start with the problem rather than the solution, and the problem might give you several solutions or several ideas of that solution, but any one of them you want, if you want to discuss in a decent way, there will be a lot of other things to consider. So that doesn't mean months of work, but it means very good thinking, very good engagement, very good reference to the discussion. The other one, but I want to just say a word, and I see a hand up, so just before return back to you, Mehnaz, is the issue of, I mean, the example that you mentioned about the sustainability of the sort of malaria, HIV, and TB programs. I guess some colleagues are referring to those programs being supported by Global Fund. I mean, that's an excellent process, but then while you are thinking of, sorry, it's an excellent topic, but then at the same time, you may wish to think of it, I mean, depends. When you start working on it, I'm just using as an example. I'm not saying I'm addressing this particular problem. So then the issue might become, oh, well, yes, all of them are linked to the certain program, but the sort of the level of political interest to them might be different, the level of financing might be different, the level of approaches might be different. And you may end up saying that, okay, well, maybe I need to have a more focused problem for my policy brief rather than a wider problem. On the other hand, you might come forward saying, no, I need a policy brief to think of how to, for example, enhance the communicable disease management structure of the Ministry of Health. Then you may also need to include others to go across a set of programs that are linked to a certain type of funding or certain line of funding to a wider range that may not benefit from the same funding. So thinking about how to phrase your problem is really important, and you need to think about it as you go through the process to the end, so that remains with you all throughout the process. Yes, thanks.
Just reflecting back on what Dr. Rashidyan said there, starting with the problem, I think is really important. And when Dr. Larvis asked for an issue, I thought about the main problems here in Bahrain. And one of the key ones is this notion of road traffic accidents, where we have a disproportionately high rate of road traffic accidents, and it's our young men who are being adversely impacted by this. In terms of the data, and to the best of my knowledge, that we tend to record fatalities around road traffic accidents, but not necessarily non-fatal injuries and all of the consequences and the sequelae associated with that, and the socioeconomic impacts and the impacts on individuals and families when road traffic accidents don't result in a fatality, but they result in serious injury that continues. So what I really, so I'm really just declaring my hand as I'm the person who mentioned the road traffic accident in the first place, and then somebody else mentioned about the bike lanes. And I take the point that this is really a multi-sectorial problem. It's one of these issues that it isn't just one department. It doesn't reside in the Department of Health, or, you know, it's multi-sectorial, and the challenges around getting these sectors to work together. And then there's various lobbies as well. So that's just what I wanted to mention today. That was really the background in terms of RTAs in Bahrain. And I'd be interested in hearing anyone's thoughts around that. So thank you very much, as I say, for a very interesting day.
There is one comment for Dr. Lavis, which is how to adapt the evidence support system in emergency management setting where time constraint and lag changing evidences are main challenges. Thank you.
Well, yeah, thanks, Mehnaz. It's interesting because a lot of our thinking about what is an optimal evidence support system came from the particular example of COVID-19, where the context was changing very fast and it looked different in different countries and over different waves of COVID, but also the evidence was changing very fast. So we think that the description that I provided in that slide, and again, the slides are available to you if that's helpful, and you can read more in the Evidence Commission report, but that description of the evidence support system is meant for both crisis times, but also more routine times. I think one of the key things that are essential to be different during crisis times are the use of living evidence products and living evidence processes in areas like COVID-19, where the evidence is evolving very fast. It's critical that countries be able to turn to living evidence products that slot in the new evidence as it becomes available. That type of living process is still relevant during routine times, but the frequency with which we update those products would be very different, less frequent, and the frequency with which we convene processes like policy dialogues to keep returning to issues like border measures and so on would also be different. We would perhaps do them less frequently, or even a one-off effort would be enough. So I think that we need to build evidence support systems that work in routine times and then can pivot to a crisis, whether that be COVID or whatever challenges we face in each of our countries in future. I hope that was helpful.
Thank you, Dr.
Can I add one comment?
Yeah, please.
Build on what John mentioned, because also we've learned it from the COVID-19, and I have to say at the time of emergency, particularly with an evolving priority area, sometimes you don't have perfect evidence. But I think the key here is to make sure that you acknowledge and navigate the uncertainty around the evidence. If you realize in COVID-19, we've learned a lot. There was a lot of academic, humongous amount of evidence, not necessarily high quality. What that means, how you can filter this out and actually bring it to the hands of the policymakers for informed decision. So it's very important to acknowledge also some limitations, some of the gaps in the evidence, also acknowledge some of the uncertainties related to the evidence. But John mentioned, is also to have this document as a living document. I think this is really very critical to be acknowledged. And I think we've learned now to have how to strengthen evidence support systems, as John mentioned, in routine time and in emergency.
Maybe, Nehal, if you allow, I also say a few words. I think that's a very key question. And also, I mean, as colleagues mentioned, a lot of new experience. In a way, it has always been a challenge between the sort of the context of the fast-moving pace of policymaking. If you talk to a normal policymaker, sorry, I mean by normal, I mean policymaker working in normal situation, still they will tell you the evidence process is slow. That's always they say that. Now compare it to a sort of a policymaker in the context of emergency, and in COVID, everyone was in the context of emergency. What we noted, there was a lot of learning within the academic community as well to be much more quick and be also to the time. So there has been that learning has become part of the process. And new methodologies, I mean, issue of the concept of living guidance and living reviews was there, but now that has become a reality. I mean, living policy brief is quite new. I don't think we had anything like that. I can't remember. So that has been practiced. So these concepts are coming forward. At the same time, what the concepts are showing us are also showing some of the challenges of the processes as well. So within WHO, I remember the first year of the COVID-19, I mean, the issue of summarizing evidence was a daily basis on what is coming out for the discussion. And so in a way, so within those daily basis processes, I mean, things go fast, they go slow, you may not have seen or critically appraise everything. And that was affecting policymakers across the globe for different areas of action. And then how to make sure, I mean, these more rapid processes that hopefully we keep them for all policymaking processes, not just for emergency context, they can also be better safeguarded. Maybe there are certain things we need to think through further. I also want to refer to one thing that I know you are very much concerned with, and you are is one of your programs, is the issue of that sort of rapid processes within WHO in the region in support of emergency countries. So that's again related to that program. So hopefully, sort of within the next few months, we are working on the experience that John and Fadi and other colleagues have, and also to bring all those together to establishing a process also in the WHO using. So obviously, WHO does that and does it for many areas of work over the time, but to make it a sort of a general process or action for rapid response to emergency requests of the countries, not just guidance of the WHO, But when the situation, a country that has limited resources would ask a question, how WHO can be in a process to go for that question in a quick way.
Just maybe I would like to focus on a priority. The policy issue is how to review the policy issue inside our countries, and to make review for the existing evidence information system, because this is the starting issue to make sure that we have a raw data, we have an information, gray literature, statistics, and many information systems here and there, but we don't reach to the streaming these information to generate a product. So there is an existing, there is a structural issue. So the problem, how to make it in a good structure, in a clear position inside the Ministry of Health, to generate knowledge in consistent way, clear way, where the policymaker can digest this information in easiest way. I'm talking about low and middle income countries, because you know about priority in our countries. Some countries, their priority on health services, securing drugs, other looking for purchasing services, other looking for several issues. So I think it's the time to focus on this, how to make a structure, good structure inside the Ministry of Health, good governance, and help the ministries of health in all countries to make it like any other department inside the Ministry of Health. Already they have the information system department, they have a routine statistics department, but this is not leading us to the to have a new knowledge or informative policy that might change something on the ground and save the life of people. Thank you.
Many thanks, Dr. Mohammed. If Dr. John, you want to address this comment?
Well, I just put in the chat box that I think Mohammed is quite right, that you can also use the policy brief approach to deal with a more inward-looking issue. So we're usually thinking about how do we address issues in the health system, but he's pointing out you can also use the approach to ask how do we improve how the Ministry of Health sets itself up to support many, many decisions. And his work with data analytics is a very good example. How do we better set up all of those information systems and draw from them in closer to real time to inform how we understand problems, how we think about options, how we monitor and evaluate. So I think he has very appropriately said to us, don't just think about issues out in the system, think about issues within the ministry about how we organize ourselves to support decision making.
This is the second question. What are the key actions for countries to enable them to request and use policy briefs and policy dialogues in policy making for health?
This question is a very good also follow-up to what Mohammed raised and what John discussed. In a way, sort of thinking of the process. So colleagues, I mean, I'm sure you have a lot of experience there. I mean, the simple question is that, does it work well in your system? How can it be improved? Any lessons learned for others? What lessons from the region? I mean, one area of work that WHO did in the region with members of Net2P, I mean, 15 case studies from 13 countries were conducted, assessing how different countries have used evidence in COVID response. So we are hoping that putting all of them together will bring some general lessons learned for the whole region and potentially also across the globe.
Thank you so much, Maharaj. I think this is quite interesting, and I'm definitely delighted that despite the challenges and limitations doing virtual engagement with stakeholders, I'm so happy and excited to see the engagement of a large number of stakeholders and policymakers on this workshop. I think this is, I do believe this could be really more of a starting point to actually continue that conversation. The one thing I want to mention, I think I like many of the topics that have been raised. I have to say that, you know, as a topic, many of them are certainly of high priority. The good news that all the topics that have been actually highlighted in the chat box, we know that there is really, you know, a huge amount of evidence on that, so including systematic issues. So the chances are that you've actually selected some really topics that actually will have substantial amount of evidence, high quality evidence that you can use. The other thing I want to mention that, certainly this is at the level of topics. So I'm hoping that if we continue and once we continue that conversation moving forward, countries, and certainly once they decide on the priority areas, this is where the work will go into try to dissect it and try to actually, frame clearly what is the areas, exactly like John mentioned about road traffic accidents versus, bike lanes. So we're really talking about the framing of each of those topics, what that means with this context, or how the problem is being framed. That's the type of not only looking at evidence, but this is the type of analysis we do of how to write the problem, as you mentioned, Renat, in a catchy way, engaging all stakeholders at the same time, and how we can systematically go about the evidence. So I think there's a lot of interesting topics that being raised. The nice thing that we have a clear process and protocol and procedure of how to take a topic into a policy brief and then a dialogue, then an impact. So this is all has been tested, and this is what I wanted to say. So I'm hoping that, with the guidance and leadership of AMRO, there will be, that conversation will be continued with the member countries, particularly the one that, initiated some topic or interested to take it one step further. You have high chances to make an impact, and I think this is exactly the purpose of this workshop. Thank you.